or the emergency room? We'll have some answers for you. Now on the American Health Journal. Research conducted at UCLA reports that 1 out of every 4 people in California lacks any health insurance coverage. For answers to this problem, we spoke with Jamie Minton, the managing director of a new company called Access Health Partners, a company that's offering a unique and affordable solution to health insurance problems.
Roughly 45, 48 million Americans right now in this country are currently uninsured. And 2 major reasons that we found when we started to look into this data was that, number one, they can't afford the major medical, which is probably obvious. They can't afford the rates. Or number two, depending on what state you live in, 45 to 53% of the people out there are unable to qualify for the coverage due to a pre-existing condition, diabetes, blood pressure, whatever. We know the average American is going to visit a doctor 1 to 3 times this year. We know that when they go see the doctor, 73% of the time the doctor is going to prescribe a medication. 87% of the time they're going to want lab work. So we looked at things like that, like doctor visits, lab works, minor injuries and accidents, your kid breaks a bone at PE, things like that. So when we first approached the carriers out there and said, let's find something that people are going to use, let's draw a circle, that was our suggestion, around the things that people use, leave off the major catastrophic, that's a different battle. We said, let's don't go there. Let's draw a circle around the things that people will use the most, and will you cover that? Only the top 5 to 10 excellent rated carriers out there. We wanted carriers that would actually pay their claims and not have to deal with those headaches. So we had 2 goals in mind. The first goal was to say, how do we offer something that's affordable? And by affordable, we had a target number, and we said, if we can somehow get the rate to $100 a month for an individual, that was our first target. And the second goal was, because almost half the people that fill out the questionnaire about their family medical history and try to apply are getting turned down, we said, how do we make this what we wanted to call guaranteed? And by guaranteed, that meant, how do we do something affordable and something that would not turn people down?
We ask how people can find out more information about the policies.
We had no idea, it had never been done before. Can we offer this online? Is there a way for us to offer this without them having to deal with the headache or hassle of an agent? And can we make this something that they can simply go to a website and pick who they want to have covered, click the price that best fits their budget, and then they're covered 10 minutes later? And that was our goal. We didn't know what we were asking and getting into. It took us every bit of 7 months to get through that compliance, but we did it. And once we had the right price, something that would not turn you down, and I'm not talking about go type it in and get a quote. We're talking, you go in, you get the pricing quote, but then you can sign up right there online. So we have a truly agentless experience and system for people. The pick, click, covered was our idea. There's nowhere else in the country that you can find the type of carriers, the pricing you're going to see, the completely online start to finish experience where you can literally buy it just like you're buying a book on Amazon. You're buying health insurance for you and your family or your loved ones. Nowhere else does that exist. We have not found anyone else that does that, gives you the amount of coverage for the price that's guaranteed and online. So it's unique. We're excited now to be able to bring this. We've had hurdles and challenges to get to where we are. It's taken us almost 2 years to get here, but we're here, and this is, we began this journey prior to the election, prior to all of the hype that you see in the media right now. We just didn't know that the timing would be like it is. But because of that, everyone's aware of the fact that, oh my gosh, I'm not insured. I need to get my family covered, because they're going to bed at night scared to death because they're 1 medical bill away from a bankruptcy or 1 medical bill away from a catastrophe in their life. That's something as simple as $1,000. This kind of a plan would take care of that. So it is unique, and we're thrilled to be able to offer it.
And now with a report on support for patients undergoing cancer treatment.